A warm welcome to all our viewers to our series Natural Medicine. I have a plastic surgeon here today. He's a university professor in Vienna, Dr. Kurt Schicho. Welcome, dear Kurt. Hello, Alexander. Thank you for taking the time to do more shows with me. We've already talked about breast surgeries. Today I'd like to talk to you about that Brazilian butt. That bottom, about how that's viewed in cosmetic surgery. But let's start with that word Botox first. I keep hearing that Botox is a neurotoxin and people inject Botox into their faces. And that's a neurotoxin that's dangerous. Is that true, or is it a myth? Yeah, it's a toxin, a very strong toxin. But we know that the dose makes the poison. You also know that in natural medicine, in fact, it's definitely a very potent toxin. However, it has been used for a very, very long time. You don't just have experience here for a few months or years, but for a very, very long time, and not just for aesthetic purposes. As you say, on the face, well, we'll get to that in a moment, but Botox, botulinum toxin A, as it's correctly called, Botox is a trade name, a product name of the Allergan company. It's often used synonymously, this trade name. They did it. Everyone knows what it means. But actually we're talking about botulinum toxin A, or what is commonly known or widely known as Botox, which is the trade name of the Allergan company. But isn't there anything smarter than a neurotoxin? For example, this is also used with people with spasticity, so people with certain types of paralysis and thus muscle cramps all over the body. It's been administered in much larger quantities and has been for a very long time. And now you don't have any dramatic damages, which means it's something you don't have to worry now that in a few years you'll realise, oh, for God's sake, we have some effects here that we don't know yet. It's just been there for a very, very long time. Of course, there are contraindications. There are situations, certain nervous diseases. Every reputable therapist will ask about this beforehand in the anamnesis for certain pre-existing conditions and exclusion criteria. Examine the patient specifically and question them about things that speak against it. But if you don't have any contraindication, rare muscle diseases, or take blood thinners, for example, during the injection, you should pause the blood thinner to avoid bruising. But basically, this neurotoxin, the effect is simply that, to put it simply, you slow down the signal transmission from the nerves to the muscles. If you observe yourself from the age of 30 upwards, unfortunately I also notice it in myself, then you tend to frown and to look sternly and with concentration when reading, when driving. I'm a very typical case. Exactly, I didn't mean to say it, that would be rude, but exactly, both of us are affected. Just like everyone else, it's quite normal. One can also stand by it, of course, and one should, but that's unconscious. Strained looking leads to that over the years, the wrinkles, or first the small wrinkles and then the big wrinkles on the forehead, just dig in. And if you now use this neurotoxin to make the transmission from the nerve to the muscle, there are of course many muscles in the face that make those wrinkles, that also make the facial expression and make these transmissions a bit more difficult. Then you can significantly prevent the formation of wrinkles, simply because the muscles are less active. And that's where it comes down to that masked face you get when there's no more emotion when injecting large amounts of Botox. That's a classic example of how not to do it, that the wrinkles are gone, so the face is as smooth as a baby's bottom, but completely rigid, so no more facial expressions, or very bad ones. Nobody wants that, because everyone says something's wrong. When you're talking and there's no more emotion on your face, no more facial expression, it's sad. And so that's why it's not complicated to inject this Botox. There are harder things. Just knowing how much and where and how to dose it in such a way that a conscious facial expression and an emotion remains in the face. But that at the same time, this unconscious activation of the facial muscles is slowed down. So it's correct, it must be a neurotoxin just to somehow slow down the muscles. Yeah, that's why saline solution isn't working. You can do that too if you inject it. It's smooth, but the saline solution breaks down so quickly that would be a good deal for me to do, of course. I inject saline and then people have to come every day. But it's not approved for that. Anyhow, there's one more thing that needs to be said, as great as it is. It's basically not a wrinkle therapy in the first place, but a wrinkle prevention. When you start with Botox, before the wrinkles have dug deep into the skin, you can use it to prevent the formation of wrinkles very, very well. You can't completely prevent it, but you can delay this wrinkle formation process very, very significantly. But that's not harmful at all. Well, the bad news is, it works, or it actually only makes sense with a few exceptions, from the cheekbone up. So, typically this glabellar line or frown line, forehead wrinkles, and also here the crow's feet. Here it makes sense, here it works, here it is proven. There are a few isolated exceptions where you can still do it. But we are so close to the brain here, and we're working with toxins. Yeah, but when you go to the plastic surgeon, they shouldn't go so deep that it ends up in the brain, so that's injected very superficially. And it doesn't go in there, into the tissue, into the brain. Into the tissue, yes, it goes through the skin, and very superficially affects the muscles. But it doesn't go into the brain, so no side effect of acting with toxins here and ultimately triggering an imbalance in the brain or something. I wouldn't have the strength to pierce the brain with a Botox injection. Jokes aside, if you mean does it spread throughout the body, which is why I previously mentioned the Botox has been used for many decades, so there is no fear that in 2 or 3 years we'll realise that any effects come to light, carcinogenic or something, which you don't know. But I also always tell patients that if the idea of injecting toxin here causes discomfort, then you shouldn't do it because it's not necessary. I keep seeing women who have injected their lips like that. There's Botox in there too, right? No, that's hyaluronic acid. You also have to say, I call it lip contouring. There are certainly people who simply suffer from the fact that their lips are perhaps a bit thin. Maybe I can understand that too. It's nice, but when there are really thick lumps, that's terrible. We already mentioned a bit in the previous show, these influencers whose role I see very critically, especially when a lot of people take them as a role model and emulate them, and actually have these small beauty interventions made to achieve some supposed ideal. This is very bad, and I always advise against it. A little bit of tracing, contouring of the lips, because they say they just feel happier, feel more attractive. That will help me if they were a bit better contoured. That's okay, I think. Ethically fine, and the hyaluronic acid is a natural substance, which is basically a substance which the body itself has. It's made artificially, but it's basically not toxic or anything. Does it break down by itself, or do you have to inject regularly? Well, over time it breaks down in the lip. There are different degrees of hardness of hyaluronic acid, so from very soft to a little harder, like tart jelly when it sets, going from quite runny to somewhat jelly-like. You have to know exactly what to inject where. And I firmly refuse patients. I send them away again if, as you say, they want a huge lip enhancement done. I won't do this. It goes against my professional ethics. I've no problem after informing the patients accordingly. Mostly they are women. For me, more than 90% are women, where I modify the lips to contour them a bit, simply to optimise the natural course a bit. There is an interesting effect that is observed very often, and that's also observed and reported by colleagues and also by psychologists sometimes, that a certain habituation effect occurs over time. The patients come first and say, I want the lips modified a bit, then you do that. I never make more than a milliliter, usually much less. And then people are very happy, so beautiful, that corresponds to my idea, and then you see yourself in the mirror every day. We men are not so vain, we look in the mirror maybe once a day, others look in the mirror more often. But over time, within weeks and months, then you get used to the bigger lips. And then that's the normal. It's like getting a bigger car or bigger apartment. First, that's big, and over time, it becomes quite natural. Or a bigger TV screen. Wow, it's big now. And after a few months, it's quite normal, this size. And so it is with the lips. The patients then often have the feeling that, I'd like a little more, but only a little bit. Well, that was my next question. And then this repeats itself and more, and then at some point, and I think that's where I see myself responsible as a plastic surgeon, there comes a point where you say, look, enough's enough. And then to explain it to people like this, I now mentioned here to say, look, you get used to it, though they're not to continue enhancing for commercial reasons, but to say, objectively, the lip, a lot is, of course, a matter of taste, but it's now simply in a dimension, in a size where I now, as a reputable plastic surgeon, no longer inject more. I advise you not to continue now, because if we still inject now, then we get what you mentioned and what I don't like myself, these injected lips. But isn't it like when you start doing a little bit of beauty adjustment somewhere that the pain limit, so the test limit, is getting smaller and smaller? And people say, well, then I'll do something here and there. Yeah, that's absolutely correct. And there I believe, well, from my point of view, the practitioner has a duty to tell the people to stop, because an injection is done very quickly. The treatment is short. With me, the consultation, the explanation, what are the possibilities, what expectations, what results can one realistically expect from it. Usually it takes me a lot longer than the actual treatment. 3 times, 4 times as long. I talk to people there just to find out what the ideas are. People often talk about something. I'd like hyaluronic acid, I'd like Botox, I'd like this and that, and in reality the problem lies somewhere else. That you really don't just inject something into people. That's part of it in the end. That's the end of the consultation, that you might or might not administer something, but I see the predominant part, or the medical activity in such minor aesthetic interventions in my surgery, actually in listening to the patients and to analyse what are the real needs, the real concerns, and what can I offer them to get as close as possible to the ideas. And especially if it's not realistic, to say that very clearly. Let's speak about something else now. At first, we actually wanted to ask about this, let's say, African or Brazilian bottom, no matter what you call it. I have the feeling that there is a huge trend to adapt nowadays, also the butt. But there's really only a pure beauty aspect, right? It's very important that we wouldn't deny anyone the right to change anything on their body if that's what they want. Like I said, you have to really seriously explain. And also there is the aesthetic surgery law, where between the first consultation and the operation you must allow a certain amount of time to elapse, and then explain it a second time. And for me it's very important. We used to talk about Botox. We're talking now because you mentioned it. I actually wouldn't have picked up the topic about butt implants or modifications, whatever there is. To mention a principle here that is actually self-evident for every practitioner, namely always to compare. On the one hand, what can one expect as a result, and on the other hand, what is the price for it? The price, and I don't mean the cost, so the financial cost, but I mean primarily the invasiveness, the risks, the possible long-term consequences. And because you've now combined that here in one conversation, to inject a little Botox here, I can take responsibility for that immediately, and after a good operation that's broken down again after half a year on average, and as I said, the risks are very, very small. Do you have to do the Botox again after 6 months? About average, yeah. But the risks are extremely small. On the other hand, if you... sorry. Is it gone after half a year? Or sometimes it lasts 8 months, the body breaks it down. Where does it go? It's broken down again, the effect simply wears off. It's metabolized, but it goes throughout the body. It's then broken down and again simply eliminated from the body. These are the normal processes, so it's not a permanent effect. Just as I said, these are things that are gentle, so to speak, with very manageable risks that are, of course, explained. If, on the other hand, as I said, because you addressed the topic, topic, do a butt enlargement. That's not on my agenda because I'm very reserved. That's done with implants. However, these are large implants. Implant decent volumes, and an implant is always a foreign body. And you have to say that this is a completely different category. On the one hand, in terms of the operation, risk of bleeding, risk of thrombosis, then the risk of infection. So implanting a large foreign body on the buttocks in the long term is a completely different category of risks in terms of long-term exposure than injecting a little hyaluronic acid or Botox somewhere. So that's really important to me, to keep apart the risks and the possible outcomes for people. With butt implants, there are, of course, situations, any injuries or massive deformities, where, of course, we have options. There's not only the possibility of doing this with implants, there's also the possibility of transferring autologous fat. But then you really have to plan and decide that on an individual basis. I'd like also to differentiate between plastic surgery or restoration, which I really find honourable and chivalrous work, to make people feel dignified or human again, just like they were before. But it's really about this ideal of beauty now, which more and more young people, I feel, they want to emulate, which gets out of proportion. I also assume you have a different feeling in your butt when you sit on it, right? That's all different. I didn't really deal with the bottom that intensively. But I can basically say, well, this aspect of recovery is very, very important to me. I already mentioned in the previous interview, losing something is far more distressing, far worse for people than not having anything. And I mean, like, when we come back to the face, the aging face can be roughly described in a first approximation as follows. When you're young, the face is more roughly triangular in shape. And through the aging process, through gravity, at the same time through the decreasing elasticity of the tissue, it moves like that. The cheeks start to sag, the neck starts to sag, and here, of course, you have the possibility of slowing down this aging process very strongly and partially to reverse it. And that means we simply turn back the wheel of time a little. And I think that's a completely different category than when you go and say, I have some pop star or any influencer and they'd like to have a huge bum now, just like this other influencer. So there I'd probably not just explain it twice, but would probably explain twice and wait thrice before actually doing that. Then we get away from the butt and stay in the face again and talk about the topic of facelifts. Is a facelift always an injection of Botox and hyaluronic acid, or is there more? Like a screw to turn and tighten it all up? Well, that's a very valuable topic that you bring up here, because I believe that, well, from my experience in my surgery, actually, very many people don't really know the difference. Because very often in advertising the impression is given that there are such gentle liftings, thread liftings, PDO lifts, plasma lifts, Botox fillers. It all gets mixed up somehow, and the message or the impression that people then get is just like, we can go to the plastic surgeon at lunchtime and just inject something relatively gentle, do something, and after the lunch break it's all over again, it's all done again. And we save ourselves the operation. This is very often a misconception. That means a lot of people have treatments made by non-plastic surgeons. Moreover, for a lot of money, and all sorts of treatments, threads inside, large amounts of hyaluronic acid injected deep, in anticipation, firstly, to do something gentle, risk-free or at low risk, and secondly, to achieve an equally good outcome, an equally good result, like with a facelift operation. And these expectations are partly completely unrealistic and even dangerous, because I always want to avoid that patients expect to do something gentle and risk-free, then get it with a worse result, and actually take a greater risk than with an operation. And in the end, because these things don't last forever, have greater expenses in the long run than with one careful operation. These facelifts, for example, have often happened in the past like they just stretched your skin. Something hangs there, you have wrinkles, and then the skin has been stretched. And where to? Well, you looked unnatural there. Put together? No, just in the direction of the ear and then cut away, to put it simply. And then you had the wrinkles gone, and your face looked like a mask. And everyone said it was lifted. Now that's bad. My approach is that a well-done beauty procedure is one that you don't recognise. So, when someone compliments a patient and says, "You've got a great lift," at that moment, the lift is bad. It's better if they said, "You stayed young, you still look pretty young." Yeah, you always have to differentiate whether there's an allusion there to a plastic surgery that you recognise, because at that moment, it's already the question of whether it's well done. I like to compare the facelift to a carpet. Here we have a carpet in the studio. I don't know if you see that on TV, but it's a carpet, and under the carpet, there's a parquet floor. And I suppose, careful as you're Swiss, you have anti-slip protection between the carpet and the parquet floor. An underlay between carpet and parquet floor, so the carpet doesn't slip. And it's similar with the facelift. We don't stretch the carpet, so if the carpet is in folds now, the carpet corresponds to the skin of the face. Then we don't stretch the carpet because then it looks unnatural. But we tighten the anti-slip protection. We tauten the slip protection, so the layer between the carpet and the parquet floor. In that case, it would be the fascia. So to put it simply, between the skin and the facial muscles responsible for the facial expressions, we have an intermediate layer. And with a well-done facelift, and of course the neck is usually included, there's no point that the face is perfect and the neck's wrinkled. The layer, that is, so to speak, between the skin and the muscles, is tightened. And the skin is then only very gently smoothed out. Perhaps a small excess, a few millimetres are removed. Here, along the ear, you don't see a scar there. And after the healing, that leaves a completely natural and not a, well, so to speak, a lifted facial expression. Everyone's learned a lot, thank you very much. Something, Alexander, that's very, very important after the operation, also the healing, because here, with such planned interventions, and it's difficult to hide your face except when you're wearing a mask, also the concern of the patients is to be able to return to everyday life as quickly as possible, to the office, to social life. Well, that was my question, the convalescence phase. How long does it take and how do you do it? Well, the swelling is mostly gone in 10, 14 days. However, I do it in such a way that I give the patients pulsating cold red light, in addition to the usual pain medication. It bothers me that this is really uncommon, so I'm very grateful to you for the opportunity to mention it here. And this is a method that's not alternative or complementary or esoteric. Rather, it's an approved medical device that I use here. Yeah, I know it, the Cantonal Hospital in St. Gallen. From the Repulse company, that's the only company currently in Europe that has a currently valid upright CE certification as a medical device. And where I was also a bit involved as a scientist in randomized controlled trials, we've been able to demonstrate with a high impact factor in reputable medical journals that it reduces pain. And with that, I not only reduce the pain and subsequently I save on painkillers, which also have side effects, but I can also improve the healing process, so significantly accelerate and improve the detumescence, the recovery of bruising, ecchymosis, the bruising. This way you can get the results faster and can significantly shorten the healing time. The downtime, as they say, where the people aren't presentable. I've heard that even the Austrian Health Insurance Fund covers the purchase of such a device today, because the study situation is so clear. Although you have to distinguish if there is a medical indication or if you have a beauty procedure. Well, then probably not. Yeah, then of course not. But with pain therapies and when restoring healing processes, to accelerate healing processes. Exactly. Unfortunately, it is still often the case here that this proven effect, that is really a proven therapy, has not yet reached everyone in the health insurance system. So that experience has shown that many patients still argue with the health insurance company or have to fight a bit to get their reimbursement. For beauty procedures, it will obviously not be covered, but it must also be said, compared to the cost of the beauty procedure, it's such a low cost factor that I say it's such a small expense. You can also rent these devices, this cold pulsating red light. The price for rent for a month is so vanishingly small, and the comfort, so in the sense that you have less swelling, that you can socialise faster afterwards, it's so advantageous compared to the cost that you should definitely do it. I'm glad to mention it here. I don't earn anything, I don't get any commission for these devices, I say this openly and make it clear here, but I just think if you can save on painkillers and thus speed up the healing process without harming people, I think you should do that much, much more. I think so too, and the Swiss health insurance companies or the Germans should deal with this topic in particular, yeah? Yeah, I can briefly say that this is a big contrast. We're already well advanced in time, but this big contrast since YouTube. We originally have talked about breast and facial surgery, lips and buttocks. Yeah. It's also fine if the swelling goes down faster. But we are talking about beauty interventions because you finally mentioned the assumption of cost by the health insurers and such. This is, of course, a very big issue when it comes to chronic pain, so chronic wounds and chronic pain. That here, because people don't just need painkillers for a few days or a week or two after an operation, this will do little harm to the body. The fewer the better, but this will cause relatively manageable damage. But chronic pain patients or chronic wounds, diabetic ulcers and the like, or complaints in the musculoskeletal system, often require long-term pain therapy. And the side effects of the drugs are, of course, a huge issue. And it's precisely here that I find that it's not just an option, but actually an obligation of the practitioner to point out this possibility of using cold red light. But then we'd actually have to inform many more doctors and therapists that such technologies exist. Well, because in radio diagnostics, for example, when it comes to exposure to radiation, which of course we don't have with light, it's long been known as completely familiar to everyone that as little as possible, as much as necessary, so any kind of avoidable radiation exposure is avoided. It's normal and nobody does it differently. Pain medication is still often prescribed too generously. If the pain's still there, we increase the pain medication, and too little thought is given to cold red light that can significantly reduce the painkillers. Understandably, I have to say that today you give away a lot of pain medication, and well, very often because in the end, everything is being worked towards the doctor being educated enough to work with painkillers. If they don't know that there's such a red light, they can't use it as an alternative. I believe that the doctors here are constantly undergoing further training, and they do it very conscientiously. It is also mandatory, and that's why I think that if you work in the field, I'm only really good in my field, and I'm also happy when I get updates from colleagues from other disciplines, and learn something new. And that's just why I'm sitting here. It's not a criticism at all to anyone, but I think that's why I'm always grateful for the invitation to talk about these research papers here, because colleagues who do it are more likely to continue with it and say, well, I'm glad I heard about it, and then offer it. And I think everyone is bound to tell about any progress they have made or are aware of, so people know the opportunity is there. I already know today that we have many doctors and naturopaths, therapists and spectators, and who take QS24 as a chance of a forum of further training. And it's therefore a great pleasure for me that I could now connect that too. So from lips, Botox, hyaluronic acid to the butt, back to the facelift again, we've got to show you quite a bit today. And everything is not so bad or as dramatically As one hears it again and again in the vernacular, that plastic surgery has a bit of a bad aftertaste, but there are really aesthetically important surgeries, which are really necessary because the psyche really suffers from it when a person's just not satisfied the way they are right now. That's okay. Good. Thank you very much. Well, thank you for the invitation. Another great show. Thank you very much, and all the best to you too. See you next time.
Ja, tatsächlich, das